Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
I'm Paula Harrison. I'm 47 years old. I'm married with 3 sons, and my eldest son's married, so I've got a daughter-in-law. I'm a hairdresser and live in Wixton, and I was diagnosed with ovarian cancer in December 2011.
So Paula Harrison's coming today. Paula, thanks for coming to join us here on the video diary program. I know from meeting you before, you've got an ovarian cancer, isn't it?
Yes.
And it's one of those cancers maybe that isn't so discussed. You know, it's one of those that you don't hear so much about in the media, but I know it is one that people obviously are diagnosed with fairly frequently. So it's one that is useful to have here documented. I'll be interested to hear what your account was. Can we go back to how the diagnosis came about?
Yes, I can. It was originally found in 2011 in December. Previously, 10 to 12 months prior to me being diagnosed with the ovarian cancer, I went to my GP because my hip kept giving way, and it was quite embarrassing that I was hobbling for 5 or 6 steps, and then they sent me to rheumatology, and then I had an X-ray and 6 to 8 sessions of physio. And then basically it was 10-12 months later that I went to the doctors because I had what I suspected was a urine infection. And I'd mentioned to my sister that I kept going toilet a lot, especially in the evening, and it was getting me down a little bit, and I got a little bit of a swollen tummy. And my sister said to me, she thought I'd got a urine infection, and she actually relayed all the symptoms that I'd got. So I was quite convinced when I went to the doctor that I'd got this urine infection. Anyhow, I only went to the doctor because my sister actually frightened me because we were going to go to Jamaica about 3 weeks later. And my sister said, you don't want to be poorly. If it ends up in your kidneys, you don't want to be poorly in Jamaica. So that's when I decided that I would go and get it checked. And the doctor examined me. Well, first of all, she done the urine sample, and she says, no, Paula, it's fine. What makes you think you've got a urine infection? So I said, well, I've got a bit of a swollen tummy and keep going to the toilet. So she asked if she could do an examination, and she did. And basically she then said, could I do an internal? And I said yes. And she says to me, I don't think you'll be going on holiday. Put it this way, if you've not, I'm going to send you for an urgent scan. If you've not had the results from the scan, you definitely won't be going anywhere. And she did say to me, I do want you to go and have your bloods done now. You'll be seen approximately in 2 weeks for the scan. And also, I will mention that I am looking at ovarian cancer. And originally I thought, no, there's not cancer in the family. So I just thought, if I have to have an hysterectomy or something, but I was totally shocked to be told that it was ovarian cancer.
But did she say that whilst the investigations were ongoing in that early stage?
She told me literally from me going in thinking I'd got a urine infection. She then said, can I examine you?
Yes.
And she told me straight away because the tumour was so big on my left ovary. Yes.
Now, you know when a clinician examines a patient and they suspect a problem, but they think it's cancer in their mind, but they're not sure whether to say anything.
Yeah.
Do you think in retrospect, because obviously we know it did turn out to be ovarian cancer in your case, would you say it's better if the person's honest and say, well, I'm wondering if it's this, we'll send you for further tests and find out? Or is it best just to say, we don't know and wait to see what happens?
In my circumstances, she'd done the best thing she could have done because she actually was making me aware of it rather than, don't get me wrong, it's a bombshell, but I think it would have been a lot worse had she not been truthful with me and then to be told that you got cancer when you've got no inkling, you've not been poorly or anything. I think she'd done the correct thing, yes.
So I suspect you prefer a kind of more honest, upfront approach.
I do, yeah.
And also, the next step often is whether to hear all the information, the kind of nitty-gritty about your condition and what might happen. What's your view about that kind of detail? Are you somebody who wanted to know as much as possible?
Yes, I'm a person that likes people to be open with me. Also, otherwise, I'm the type of person that perhaps your mind can start playing tricks, and I like people to be honest, and I like to know exactly what's what. And sometimes it makes you, if I think of the worst case scenario, anything that comes back that's good, positive and a bonus, and that's the way I preferred it to be.
I see where you're coming from. So what was the next step for you? That was she was basically sending you for tests then, but presumably you went to the hospital for more tests.
What happened actually, the day I seen her, that evening we went out with friends and I mentioned to them that I'd been to the doctors and what they said, and by the time we'd eaten the meal in the evening, I actually looked about 7 months pregnant, and I felt very bloated, uncomfortable, and I also felt a little bit out of breath. So my husband actually that evening decided to take me to the hospital, and they done, I think it was an ECG, and my heart, they actually said just from the ECG that I wouldn't be going home that evening because it wasn't correct. And actually the nurse there did say to me, as your doctor told you why you're going to have the scan, etc. And I said yes, and she says, oh, I'm really glad. She asked me basically what they'd said. She says, because I was going to have to tell you that anyway. So basically my husband took me, they kept me in, and they'd done the scan the next day. So that was on the 23rd of December 2011. I found out the next day, 2 days before Christmas.
You can remember that quite clearly by all accounts.
I can.
When that was disclosed, obviously it's a very hard thing to hear. What do you remember about that breaking bad news occurrence when they told you what exactly was going on for the first time?
The lady that come and broke it to us, she actually, the good thing that I found she did do, she took us into a private room. And I knew as soon as she said about taking us into a private room, I said to my husband, it's cancer. So he says, not necessarily. So anyway, we went in, and she was a lovely, lovely lady. But the thing I did find, she told us all the negatives, and basically me and my husband, then she left us after approximately perhaps 10 minutes, 15 minutes. She left us alone for a while, and she actually, although she was a lovely, lovely lady, we don't feel that she actually gave the diagnosis correctly, because she made us think that basically I was terminal and there was nothing they could do. So my husband and my own thoughts, we were absolutely obviously in shock pieces. My husband went a bit angry, but then I think he realised and come out of that quite quick. But we said after, when she came in then, and she was saying then, she says, but the good thing is it's not in any vital organs. And we thought, well, why didn't she tell us all this before? Because we thought basically that I wasn't even going to be offered chemotherapy, no operations, nothing. So she was a lovely lady, very considerate lady, but she should have told us everything before she left, then come back to see if we was all right. But she only told us half of what was happening, and then basically she came and told us the other half when we'd had all negative thoughts going through our head.
Can you say to people what stage or degree of cancer you had? Because I remember you telling me before it was quite advanced at that stage.
It was. I did ask the team what stage cancer mine was at, and it was at a 3C. And I was told it would have been a lot better to have been caught earlier. And I ended up with the cancer in 6 places. Yeah.
And that was found later, I think, when you went for surgery, is that right?
Yes, well, the scan itself actually shown that it was in 3 places. And when I had the biopsy done, they didn't look all around because it was quite advanced. They had to basically give me chemotherapy as soon as possible and do the major surgery as soon as possible. So basically they just worked with the scan, with the biopsy at looking around my womb and my ovaries and everything. And originally I was told that it was only in the one ovary, not in my womb and my other ovary. But after the biopsy, it was in the other womb and ovary. And then I also had it in they call it for short a fat pad. And I had it on the surface of my liver and just on the surface of my diaphragm as well. So there were quite a few spots that were definitely adding to the burden that you were facing at that time. Yeah, there was, yes. And what did they say about this in total? What was the plan at that stage? Originally, when I seen my professor, because the way it was diagnosed to us, and it was relayed back from the nurse when she told me that I'd got cancer. My husband and myself thought it was terminal, and we were actually believed that I'd only got weeks, if months at the most, to live. But it wasn't until we spoke to the professor that made us so much more positive. I asked him, I said, am I terminal? He says, no, you're not. And he says, you're very young and you're very well, very healthy. We're going to blast and give you everything. After my surgery, the gentleman that actually done the surgery came in, and he did say to me that he's managed to get rid of every bit of cancer that he could see. So it was actually after the surgery that things seemed much more positive, because prior to the surgery we knew that it was in 5 places. It was only after the surgery that we knew it was also on the diaphragm. But prior to the surgery we were thinking, how many more places is it going to be? You know, will they look and just think there's nothing we can do? But it was really, really positive after the surgery, the most positive, you know, that we'd felt. I mean, in a way, I think that's important for viewers to hear who are in a similar situation where they've had a diagnosis and it has spread to some extent, you know, they call it metastatic, don't they, when it's caught, when it's had other deposits, not necessarily just in that local area. Obviously that is a bigger scare, but it doesn't necessarily mean that there's no hope at all. There were still options to explore. Yes. And well, we're skipping ahead, but you seem to have done well actually after that point. So I think a lot of it is positive thinking. I've had a lot of support from family and friends. I mean, I've got a wonderful family, wonderful friends, and everybody's kept me so positive. I am quite a positive person, and I am a fighter anyway. But that doesn't mean that you don't feel low sometimes and shed a tear occasionally. That's natural though. At the end of the day, we're all human, and you know, that's the way I think you get through it, you know, and by talking about it and everything.
So let me take it from the point then where, you know, you'd received that diagnosis, treatment had been planned, and you'd gone for surgery. What was your outlook at that point?
After the surgery, my outlook was even more positive than I was before, because originally I was saying, well, I'm going to fight this all the way irrespective. But after the surgery and being given that positive feedback that he believes he's got rid of everything, but obviously you can't be guaranteed that, which is obvious. You just have to keep thinking to the future, think of the ones you love, of your family, and you've got to keep positive.
Did they offer you any more treatments at that stage, or?
Oh, after I'd had my major surgery, well, prior I'd had 3 lots of chemotherapy. I should have had a 4th session, but I ended up with a temperature, so they wouldn't let me have it. I had my major surgery, followed by 3 more courses of chemotherapy. And basically the chemotherapy and the surgery, I was really, really well, considering what I was led to believe, not by the team or anything, but by people in general. When you've had chemotherapy, they actually relayed that I thought I would be so ill, that I wouldn't be getting out of bed, all sorts, but it wasn't anything like that. Yes, my legs were a bit weaker and I'd stay in bed a bit longer, but the chemotherapy, I got through it really, really, really well.
And I'm sure you saw some people who didn't manage so well when you were attending on the chemotherapy suite. Yeah.
One of the ladies I've made friends with, bless her, she couldn't have the chemo. She got the ovarian cancer the same as myself, but the chemo made her quite poorly. But our team then sorted other types of chemo out for her, and she's tried several different types since. So yes, it's not the same for everybody, but I think one thing with myself that made it a lot more positive for me and made me feel a lot weller in myself, I was determined that I was going to eat well, not watch my diet, and really, really eat well to help absorb the medication and everything I was having. And I also drank plenty as well to be flushing all the things away out of my body.
I'm sure that helps, but did you have an appetite that was fairly strong then?
I did, yes, I really did. I know a couple of days after my chemotherapy you'd have like a metallic taste, and that wasn't really nice, but I still made myself eat because I didn't want side effects of the chemo to make me feel poorly. So I was just adamant, you know, and just carried on eating.
Thinking about your treatment experience, you know, that period in hospital and the follow-up treatment, would you have changed anything that happened during that time?
I was really happy with the team that I was under. I had a really, really caring team. I'd got my gynae nurse on the end of the phone, Louise Bolter. Anytime I'd got a problem or I was worried about anything, she would always be there. And if she wasn't there, there would be an answer machine and she would always get back to me as soon as possible. And that saved a lot of things of having to go to the doctor if you were worried or anything like that. And I feel that the backup, even though it's 12 months ago, if there's anything that I'm not sure about or I'm concerned about, don't get me wrong, I don't bombard Louise with questions and what have you, but if there's anything I'm not sure about, I know she's always there at the end of the phone, and it's wonderful. Yeah.
Now I'm interested in one particular area where you have special experience, because you were previously a hairdresser, weren't you?
Yes, I was.
And obviously you did face the classic side effect of chemotherapy, which is obviously losing the hair at that time. What was your whole what was your way of dealing with that, and what advice would you give, you know, having had that background experience?
Right. Originally, when I went to the gynae, and I was told that I'd got to have chemotherapy, and I was told that I'd lose my hair, did that bother me? And I said no, because obviously I wanted to have the maximum dosage I could to actually clear the cancer. So the first thing that did come into my head, and I don't know if it's because I'm a hairdresser, but I thought, I'm not losing my hair for nothing. So that was the first point of me starting fundraising. I said, I'm going to have my head shaved for charity. And it was very, very hard, but the one thing I couldn't bear the thought of was my hair falling out on my pillow, and also clumps coming out when you wash your hair. I think that would have been a really, really stressful, traumatic time during the cancer had that happened to me. So I did decide to have it shaved on a number 2. So originally the salon I used to work for, I went there, and a lot of people, it was really packed with all friends and family coming to watch. I must admit my 3 children, my 3 sons and my daughter-in-law couldn't come to watch. They've supported me all the way, but it was very hard for everybody. I think everybody cried apart from myself, and that is because I knew it was to be coming off for a good cause. Approximately that evening we raised about nearly £400, and my son also has put me onto a website, Just Giving website, and I believe that perhaps got about £800 donations as well for it. So basically that was the best thing I'd ever done, and it's something that I can strongly recommend to other people to really seriously think about, because I know if that hair had been coming out in clumps on my pillow or in my hands, I would have been devastated. And I think that would have been a very negative part of...
So in actual fact, you were very proactive and brave to take a big step almost ahead of time to shave your hair.
Yeah.
Which I know not many people think about. No. But what you were doing cleverly was you were taking control over the situation.
I was, and it's like I say, I haven't had a tear over it. I never, and I thought I would. And basically, the reason as well that I decided to do that is ovarian cancer isn't widely known the symptoms of, and I wanted to make awareness of ovarian cancer to other females, because basically I'd had my smears regularly, and I thought basically a smear would cover everything in the ladies department, and actually a smear does not detect ovarian cancer, and it does not detect womb cancer either. So bearing in mind I had cancer in 6 places, and I was really, really well. I wasn't even poorly, so it come as a major, major shock. I felt that I've got to make people aware of this. I've got to do something about it. I've got to do my bit. And that is when I thought, I'm going to start fundraising for ovarian cancer action. And that's what I've been doing.
Fantastic. We'll come on to that in a second, but just before I move off from the hair loss, there's one other side, which is, what was your experience of the hair growing back? I mean, how long were you waiting, and when did you think it was satisfactory compared to having had the end of the chemotherapy?
When I I had it shaved off, as we said, and then when it come out altogether, I used to wear a wig until approximately for around 6 months, because after you lose it, you're then still going through chemotherapy at 6 sessions every 3 weeks. So you've got a few months that you're actually having chemotherapy, then it's got to grow. And I found that, I wasn't wearing the wig around the house when the children and my family and everybody were around, but if friends and what have you came, apart from certain friends, I would put my wig on, because I think I felt better, with my wig on. And also I didn't want anybody else to feel traumatised by, you know, by seeing me with no hair.
And last time I met you, you had the wig. But
I
then,
did.
Obviously, at some point it came off. So how did you decide on that point?
I think, like I say, with not wearing the wig in home with my family and friends, and eventually, as my hair was growing a little bit more and a bit more, you'd let the odd other friend see you, and then they'll say, your hair looks fine, I don't know why you're putting your wig on, and things like that. And other people are really telling you then.
Yes.
You know, my boys are saying, Mum, why are you putting your wig on? You really don't need to.
So you were getting feedback from others.
But
From you had to be
family.
a bit brave to do that, because you had to show them how you were, isn't it?
That's right.
And that's the people. Sometimes people really struggle with that. Sometimes people would say, well, I'll never go out without my wig.
Yeah.
So then they never kind of get that feedback in a way.
That's right. Like I say, because some people will wear the wig and they won't basically want even the family to see them without it, whereas after the initial shock, perhaps because I'd had it shaved actually on a number 2, again thinking about it, that would have really helped, because although it wasn't bald, I was almost bald, and I used to go around with it on a number 2 for a couple of 3 weeks before I actually lost it to nothing. So that actually again is another positive point, that people were aware of seeing me like that, and also I'd raised major money for the charity as well.
You
thinking
made
about
the
it.
step more gradual by having a kind of interim.
Yeah.
You know, if you'd gone from somebody with really long hair to none, everybody notices a change, don't they? And then they might get more remarks or comments that you might not want. But if you do it in a stepped way, if it's possible, and you describe one way it is possible, then yes, it is kind of easier to avoid that.
Yeah, and I think as well, like, rather than just losing your hair, like I said, if it comes out in clumps and then you've got bits hanging here and that's still hanging around and it doesn't look nice at all, I think it's just so much more of a positive, you feel positive, and like I say, because I've raised money for it, it was perhaps a lot more acceptable as well for me to be going around with my hair like that, because everybody knew that I had had it shaved off for the charity. And actually there is one point that I will mention. A lady that I know that was diagnosed approximately a month before myself, she was asking my son when he was out, how's your mum? And she said, she's fine, thanks. And he explained that I'd had my hair shaved on her number 2 because I didn't want to lose it, etc., in clumps and get distressed and upset over it. And she turned around and said, your mum's done the best thing she could have done, she says, because she wishes now, after obviously the event, that she'd have done the same sort of thing, because she said when she washed her hair and it was coming out in clumps, it absolutely broke hers and her daughter's heart. And she said, I think what your mum done is the best thing she could have done, and had she had the choice again, she would have done something very similar herself too.
Interesting. Just a question, did you ever get offered a cold cap in the chemotherapy suite?
No, I didn't. I found out
about
that. I can't remember how I found out about it.
It's
I
a
think
fairly new thing, but it's...
It was on actually when I was there, but I wasn't offered it.
Can you describe it just for the
Well, what
viewers?
I've been told is apparently they're put in, I don't know if it's like a freezer or a really cold fridge, I think it's freezer, and you put that over your hair and it protects your hair coming off. But no, I wasn't offered it, but we did question it when we were at chemo once, myself and another chemo patient, and they did get one out and show us.
I think the idea is it reduces the circulation to the scalp whilst you're having the chemotherapy.
Right.
So the chemotherapy agent is not going so much to the hair follicles.
Right.
And then you don't wear it for long. Afterwards, you remove it. Right. So then you back to normal.
So does that actually work? Do you know?
Well, I've heard it does work to some extent.
Right. I don't know, because we weren't even told about it, which was a shame because it was there on offer. Well, it wasn't on offer because we weren't offered it, but it was actually in the chemo suite when I was having chemo.
How do you feel about your hair now?
I feel really happy with it actually. I love it. I don't complain about it now. Now I've got it back.
It must be a less hassle as well to not have to think about the wig, just to have your own hair back. To
be truthful with you, the wig's easy because you've not some ladies spend a long time each day doing the hair, and the good side to a wig is you just give it a little shake, put it on, just put your little fingers through it. So I did enjoy my wig, but obviously I do prefer having my own
So there
hair.
is a kind of shortcut effect having the wig. So yeah, I didn't think about that.
There is. It's got its benefits, definitely.
Let's come on to a new area now, which is how did you cope emotionally through all of this, through the whole period of time we're talking about?
I think because I do come from a very, very loving family. I have a most wonderful husband and children, parents and family, and I have a very big circle of friends as well. I had so much support, and basically not enough hours in the day to be doing a lot of things that I'd have, you know, still carried on wanting to do. I think because I had so much support and positiveness, you know, I cope with it really well. I cope with the major surgery, I cope with the chemotherapy. Don't get me wrong, sometimes you will feel a bit lower and exhausted and things like that, and you can have your emotional little times. That's natural because we're human. But on the whole, I coped wonderful, but I had wonderful people behind me, you know, backing me up all the time.
That's good to hear. Did you ever have a low period, a down phase where you felt depressed or very, very anxious in yourself?
I say sometimes you can. I think when I found it hard was I was actually the strong one for everybody. You know, when you see all your loved ones absolutely in pieces. And my middle son really struggled with it. Everybody was absolutely devastated. All my children, my husband, my parents, sisters, you know, everybody, family, friends. But I think when you see them so brokenhearted, that does get to you, but then you've got to be strong for them. You've got to help them through it. And if anything, you perhaps occasionally have the odd silent tear because you want to be strong and positive for everybody else. And I think it does you good to have a little cry now and again to get it out your system, and that actually makes you positive again, you know. And also to speak about it, I think is a really important thing, because I think if you keep it in too much, I think that's a negative, you know, can give you many negative thoughts, and I think to speak about it helps you with so much more.
Particularly if you're very anxious and dwelling on what might happen but can't resolve it. If you just going over that in your own mind again and again, it's very tempting to get stuck there.
Yeah.
So who did you prefer to talk to as a preference?
I think because I am a person that does speak up in general, you know, if anything does bother me, I could virtually speak to any of, you know, my husband, friends, family. I could really speak to anybody. But I did find at first you're trying to protect your children a little bit, because at the time of me just being diagnosed, we did come clean with the children. But there was one point, my middle son was doing his final year at university, and basically he came home. He had been at university for 3 years, and he came over the final year because he wanted his first, and he says he knows that's why he would have got his first. And he come home, and originally everything was going brilliant. He got top marks for everything, you know, in this final year. And then when I was diagnosed, suddenly his world fell apart, and he said to me, "It's not important, is it, Mum?" And he couldn't concentrate, nothing, and it really badly affected him. But although we told them about my diagnosis and what have you, we didn't actually tell them at the time that I couldn't tell them that my chances were very slim. And basically I remember James couldn't bear to be in a room when anyone spoke about it, and it got to the point in the end that the phone was always ringing, which was lovely because people are concerned. And it rang for weeks and weeks and weeks, and basically in the end James couldn't answer the telephone. And I remember at one point him saying to me that I wasn't being positive enough, and I had to explain at that point to James that no, prior to that actually, I'll say, Mum, I know you'll get through this. You're the most strongest person I know. And so anyway, then when time went on and he told me that I wasn't being positive enough, I had to explain to him exactly what I was told in a bit more depth. And he was absolutely beside himself, absolutely heartbroken in pieces. And then he realised, because he used to get a bit angry, when he realised that, he was just in bits and got his arms around me and says, you know what, Mum, I know you're the strongest person, you know, and if anyone will do this is you. But perhaps because we didn't tell him the full extent from the very beginning.
So you were trying to protect them a little bit.
Yeah.
You did tell them the basics. I mean,
we
about
did,
the cancer.
Because they don't know anybody with cancer, and I suppose they don't understand cancer to, you know, a certain degree. They didn't realise it was as bad diagnosis as it actually was.
And in the end, how did you find his emotional state changed over time?
As soon as I'd had my major surgery and everything seemed so much more positive, it changed all of us, even himself, everybody. And I've got James back to being how James was prior to my diagnosis. Like I say, everybody was devastated, all my children and husband and everybody. But after the operation, it was a much better.
Well, that's good to hear. Although, to be fair, I also know you personally were quite positive as a person before.
Yeah.
You should give yourself credit. You were a very strong person, even in that very uncertain early time.
Yes, I was. I am quite a strong person, and basically, I adore my family, and I've got to do everything I can, so I'm still going to be here for them. I have actually, since being diagnosed with the cancer, I didn't do it for a few weeks, but I actually changed to going dairy free, and I don't eat meat now. That wasn't suggested or, you know, from the hospital or my team or anything, but after doing some research with a friend, it's a big thing in America that they do believe dairy feeds ovarian, breast and prostate cancer. So basically, because I'd had it in 6 places, I thought I've got to do everything I can to beat this disease. I've got to do it for my family. So basically, I've changed my total eating habit and everything, and that's another thing that makes me feel so much more positive.
Did that affect your general physical health?
Not at all, no. At first it was hard because you're going on a totally new diet with no dairy, no meat, and I was a big meat lover and I loved dairy. So it was hard at first to sort of change your diet, knowing what to eat, knowing what to cook, but it just got easier week by week.
So you got into a routine and you didn't find it a big struggle?
No.
Do you feel healthier for it though?
I do, yes, I do. Yeah.
That's good. I'm going to ask you about another area now, which is about recognition for ovarian cancer and about ovarian cancer in general. I mean, like I said at the very beginning, it's perhaps one of those cancers that's not so much in the news.
No.
But you're doing quite a bit to promote it, and other people are beginning to as well. Do you think there should be more recognition for ovarian cancer?
I think there should, because ovarian cancer is classed as the silent killer, and basically they mean the silent killer because the symptoms can be, as an example, you're bloating of your tummy and what have you, it can be dismissed for irritable bowel. You can think it's middle-age spread, you're putting on a bit of weight and things like that, which I originally thought. And like I say, because I'd had all my smears up to date and what have you, I never dreamt that I'd got ovarian cancer. But like as I mentioned before, with your smears, they don't actually pick up, don't detect the ovaries nor the womb. And I just feel that I felt really strongly, considering I'd got cancer in 6 places and I was really, really well. It was total flukes that I went to the doctor. I wouldn't be here now had I not gone to the doctor then, because I was really, really well. I think that's why I'd done my fundraising, because I felt so strongly that something needs to be done. If I felt so well and got cancer in 6 places, that's why I got on to thinking, right, I'm going to do the fundraising and I'm going to do it for ovarian cancer. And that was, that has actually kept me really, really focused throughout all my treatment and everything, because from day one of knowing I was going to have my head shaved, that is straight away when I got onto the ball of raising money.
Yeah, I guess ovarian cancer is one of those where the symptoms are not as well known, and also there's no national screening program as a routine. And as you say, there may be sometimes an assumption that the screening that does go ahead covers everything, but it doesn't actually. It just covers those specific cancers.
No, and there is actually, I had my bloods taken and checked. They checked my CA125, and that actually does detect ovarian cancer. And apparently that should be below 35. Mine was over 5,000. So I just wonder where along the line they can start in bringing that in with smears or something, because I am led to believe there's something going on in America at the moment that is actually looking into a test that will actually detect womb, ovarian and cervical cancer.
Yes, that's one of those hormonal markers that may be useful and could be developed into some kind of screening test.
Yeah.
And what do you think is needed in this field from now? Do you think we need more media coverage, or do you think we need more, like you said, fundraising or some other areas?
I think we should have more media coverage, definitely, like you do for breast cancer. And I believe, like how they do the monograms, this, that and the other, they should be doing things also for the ovaries, the ladies. Like I say, I can't understand why a smear is only just doing your cervical cancer and they can't combine it together to be checking your other areas, because like I say, I've always thought, and every female that I've spoken to has always thought, that once you have a smear test, that's covered you and you're fine.
It's because we kind of focus on those classic breast cancer, cervical cancer, and in men, prostate cancer, and then colorectal.
Yeah.
We forget a lot of other subtypes of cancers which are still relevant. But yes, I think you make a good point there.
You see as well, it's like when I was originally when I originally went about my hip giving way, if I was given then a scan 10-12 months previously, my diagnosis would have been a lot better, because the reason, which I did forget to say earlier on, that my hip was giving way, my tumour was so large, it was actually 20 centimetres by 10 by 7, and because it was so large, that's why my hip was giving way. So it was nothing to do with arthritis or what have you. And I feel that the National Health Services gave me an X-ray. I had 6 to 8 sessions of physiotherapy needlessly, because in the end I had to have a scan. It's 10 to 12 months down the line, so my prognosis was worse. So initially I've had to have a lot more treatment, so it's cost so much more money than doing a scan from the beginning.
Yes, I take your point. In general terms, it's definitely better to find things early, isn't it?
It is,
as early as possible, and that's what we're generally trying to do. But like you say, we're not always able to do that for various reasons, and particularly for those cancers without a routine screening program. A lot of cancers are missed until quite late, and occasionally they're not picked up at all. There are some people who the cancer's never diagnosed before it actually causes them to die, unfortunately. It does happen. Let me ask you now about where you see things going in the future for you.
I'm just being really, really positive. I'm saying that I'm absolutely going nowhere. I love my family too much. Don't get me wrong. Occasionally, you know, if you have these little feelings, because I've had major surgery, sometimes you do have little feelings sometimes inside, and you think, oh, I hope everything's okay. But that's going to be natural, because I've been told now that I've got to take notice of my body, you know, feelings that normally you'll dismiss as nothing. But basically, I just believe being positive and also fundraising, and I'm also wanting now to give more, because this is perhaps a bit of a wake-up call, an eye-opener. It makes you appreciate your life more. You think you're going to be here for eternity, and you just don't know what's around that corner. Like I say, it was a major shock, and now I'm feeling that I want to help wherever I can. If there's anybody I can speak to and help, you know, with cancer that's just been diagnosed and things, you know, I just feel that I want to help people that are in a very dark place at the moment, and that need reassurance and somebody to talk to. And I think sometimes as well, some people can't speak to family and friends, or don't want to, you know, and they need an outsider. And I feel, you know, that's something that I would really like to be able to offer to people, given the opportunity.
Do you think you're a different person now, having come through everything you've been through with the cancer?
I wouldn't say a different person, because I do believe that I've always been a very caring person, always care about people. I think, if anything, it makes you think a little bit more, that you want to be doing something to help other people more than just, you know, your everyday things that you would normally do. You want to help people, like I say, that are in dark areas, where they need a bit of support and what have you, that haven't got, some people perhaps don't socialise much with friends, or have only got a small family or no family. You know, I just feel like I would really like to be there to help them, to give them the support and to make them feel positive.
Do you think in general we should be using that premise, i.e. introducing patients to other previous patients who'd been through it and learned from it, i.e. peer support they call it?
Yeah, I think that's a really good thing to offer. There's a lot of people that won't go and ask for extra help and what have you, you know, but there is a lot of help out there, and I think it can help so many people that are feeling really down and negative, and they feel, you know, that their life's at an end and things like that, and they feel they've got no fight, they feel they've got no future, nothing to look forward to. I think if they could speak to people that feel really positive, that can give them, you know, reassurance and make them believe in themselves, that they, you know, there can be light at the end of this tunnel. I think that's a good way to go.
Would you like to say anything from, you know, thinking about viewers watching this? Some people will have cancer, and some people may even have quite an advanced cancer like yours with spread somewhere, and they're hearing your story. Is there anything you want to say to those people watching?
Don't sit at home on your own crying or feeling really low. There's so much support out there for you, and speaking to other people eases the worries off of you. You're getting positive feedback off these people. It makes you feel better, and basically it can turn your old negative feelings around to make you feel more positive and see that there is a future and there's people there to guide you along. And the things that you worry about, you may find that other people are worried about the same things if you speak to them, and basically they can help you look at things in different lights. And I just feel that you shouldn't be on your own worrying. There's so many people out there to help and to give you the positiveness to make you feel more positive.
Well, Paul, I think you've given some good advice there for people, and I'm inspired by your story particularly, because not only have you had that diagnosis of cancer, but in that early phase you were told it was quite advanced, and you know, you're coping really well, and that will be an inspiration to people watching as well. and I want to wish you all the best for the future. And,
Thank you very much.
Maybe we'll have a follow-up interview and see how things are going, see what the hair looks like this time next year.
Well, like I say, last Christmas, I didn't think I'd be here this Christmas, and I am, and fighting strong. Positive thinking, I think, is the main key.
Absolutely. Take care.
Thank you. Thank you.